And here we are back on the couch. As you may have noticed, I'm not Buzz Burrell. Buzz has taken off. We can't find him. So I'm the second place to you all. On the couch now we've got Jane O'Malley. Jane has had a flying visit. She's had a busy week, she tells me, and she's come in to talk about a population health-based program that the ministry is encouraging at the moment. Jane, do you want to tell us what you were speaking about during your session?
Yeah, thanks Mark. Well, firstly I just said how good it was to be at the Rural GP Network Conference because of my background as a rural person and as a Director of Nursing on the West Coast. And I suppose a lot of my thinking around healthcare in general is around clinical and financial sustainability and the role that nurses and doctors play. But one of the things that I talked to people about was our health policy around integrated, more seamless services for people. Services closer to home, as safe as possible, and what that means, particularly in a rural area, and where people can provide kind of point of care, but also use local, regional and even national connections, and the role of telehealth. And a lot of, I didn't go into that in great detail, but it's really just alluding to the skill set that's required of health professionals in a rural setting, not only clinical skill set, but also kind of social skill set, social networking, and then the role of them as kind of coordinators of care right across maybe even the country. I also talked about the new policies around clinical integration and how that really starts built on the premise that actually preventative care and people taking responsibility for their own health is really important.
Jane, you talk about the new policy. What was the basis of the new policy? Research based or feedback from healthcare professionals? You know, where did that come from? A need or?
I mean, I think probably. It's a national government policy, better, sooner, more convenient care. Minister Ryle has been very clear in his vision around that, and I suspect he's got that talking to people. People want better, sooner, more convenient care. And for rural people, I think rural people are very practical. They know the risks of living in a rural community, but they also expect quality care to the level that would be expected in their locality.
But none of that's new though, is it? I mean, this has been spoken about for a long time. So what's the new bit of the whole thing?
I suppose it's not new, it's possibly the emphasis on it, the pace, the scope of it, it's not new.
So
it's interesting that you should say that, because no, it isn't new, but it feels fresh in that. I suppose what we've also been looking at is some of the former contractual arrangements that have created fragmentation of healthcare.
Because this is where the rubber hits the road, isn't it? Because people do what you contract them to do.
That's right.
So what's the changes that you're asking for there?
Well, I think it's, and this is where the role of consumers of care and the role of providers of care is really important. And Minister Ryle's really very clear about the need for communities and health professionals to co-design services. And so forgetting about where the funding is, if we could do this in a different way, what would it look like and how does it make sense? And then worrying about how we might fund it. But there's also new arrangements, so there's expectations on district health boards and PHOs to be clearer about what they're looking for, population health focused, more convenient, seamless services, and then looking at what are the enablers. And so I talked today quite a bit about workforce. I'm very interested in obviously the nursing workforce, but one of the doctors at the end of the session talked to me about the importance that nursing plays in maintaining the medical workforce. So where there's a dearth of nursing or medicine, you'll find that doctors and nurses are reluctant to be there, but actually if you have a network of, and that would go for midwifery and allied as well, the importance of clinical networks at the local level.
So can you give me an example of where it's happening really well at the moment? I mean, is there a good example of where you think other people could go to and learn and share the experience?
Well, look, there's heaps of examples. It would be almost wrong of me to say where there is an example, because I think there are so many of them, and certainly working on the West Coast, I could see where there are examples already where you know, the nurse working in HAST provides the care 24/7 to a group of patients, but if she needs guidance, there's always a doctor on the phone at ED in Greymouth at the base hospital, but also Martin, she knows the visiting doctor will be down for one session a week. So, and then there's a local ambulance service that if necessary, or the helicopter if necessary. So there's one example. Another example is some of the work that's being done in aged care, where District Health Board nurse practitioners and gerontology specialists are reaching into aged care and working with registered nurses in particular and caregivers around a whole range of quality improvement services. That actually means that care can be provided as close to home, in this case in an aged residential care, with support from specialist services rather than dragging them into the hospital, particularly after hours. And so giving people confidence that they can actually do this with someone on a phone or with some education. So, yeah, heaps of examples.
So, what advice were you giving to the rural people today? I mean, was there any kind of like, here's something you can wrap in a bow and say, you know, here's some policy and here's a contract, do this, and is there a path you're leading people down?
There was a couple of pieces of advice I gave. One was, I asked them did they know about contract alliancing, and everybody did. I asked them did they know anybody who was involved, most of them didn't. I asked them to go and find out and to make themselves known and talk to them about their good ideas and also the things that frustrate them in their jobs. So I talked about that. I also encouraged nurses to know where their nurse leaders are at practice, at PHO and at District Health Board level. I talked about my discussion with the directors of nursing of District Health Boards about their role as jurisdictional leaders, so not just leaders of hospitals, but actually across a whole range of services, including aged care, primary care, and where appropriate, rural care. I suppose if I said anything, it was actually keep on doing what you do well, because you've been doing it for years. We're just catching up with you, and there's lots of lessons to be learnt from rural.
Jane, thank you very much. One final thing before we go. I'm doing a straw poll on who the next Minister of Health will be in a national-led government. Your pick?
Look, honestly, I am a betting woman, but I wouldn't like to bet on that. I don't know who it will be. All I can say is that Minister Ryle is a very astute man, and he's been a great minister, and it will be a hard set of shoes to fill, but I couldn't tell you who will fill.
And you know, every person has said exactly the same thing as you. So
yeah, well, I think that's because it's genuine.
Yeah, I would agree with that too. Yeah. Jane, thank you very much. Now we'll head back to Buzz fairly soon and continue our day.